Let's go live now to Dr John Boffa. He's a GP in Alice Springs, a spokesperson for the People's Alcohol Action Coalition that Matt just referred to. John Boffa, you've warned of this not just for months, but for years, the sort of impact that alcohol has in the top end. From your experience, since the lapsing of the Stronger Futures laws, what have you seen? What's been experienced on the ground?
Well, look, this is a preventable alcohol-caused crisis coming from the lapse of the Stronger Future laws. And, you know, to bring it back to the practical implications of the voice, if the Indigenous Voice had have existed, it could have advised the Commonwealth government what would happen if this legislation lapsed. So this is an example of what could be the practical importance of a future voice to Parliament. But that wasn't there, so this legislation was allowed to lapse. And from the day it was allowed to lapse, we've seen people returning to Alice Springs, to the riverbed, to drinking, you know, over the road from where I live. We've seen preventable domestic violence. We've seen the problems that alcohol causes in terms of care and protection of children, you know, child neglect, young people not getting food at home, not getting the care they've got a right to, women not being safe, the community not being safe, the hospital being overwhelmed with alcohol-related harm, surgeons flat out dealing with the trauma, dealing with the fractures, dealing with the stabbings. So it's to be clear, it's not back to where we were in 2005, although this is a precipitous crisis. But for many years, people had experienced Alice Springs pretty much as a normal town. That's how effective these alcohol measures were. And unfortunately, although the Northern Territory government has put in place some of the world's leading alcohol reforms, there was a lack of awareness just how important this one single reform has been amongst all the reforms. So it wasn't just the People's Alcohol Action Coalition, it was the Aboriginal Health Services, the Aboriginal Legal Services, other leading women's councils, Aboriginal organisations wrote to government saying, if you allow this to happen, it will be carnage. And what it will lead to is a lot of people coming back to Alice Springs from all over Central Australia because they're going to have free access to takeaway alcohol. What was important about the previous laws, it only affected takeaway alcohol, and it only became successful, not the bans in themselves, it was the police on the outlets were able to use those legislative bans to stop people purchasing takeaway alcohol. Everyone's allowed to drink on licence unless they're on the banned drinkers register. But it was access to takeaway alcohol that was prevented. And it was prevented for more than 10,000 people living in Central Australia. So overnight, the tap was turned back on fully for around that large number of people. And what's happened was predictable. And equally, the solution is just as predictable. We have to go back to the future. We had a successful policy. It has to be put back in place.
What do you say to suggestions by the Chief Minister in the Northern Territory and by the Attorney General that the grog bans reflect racist policy?
Well, look, the People's Action Coalition disagrees with that, and so do many Aboriginal leaders and leading Aboriginal organisations. Not all forms of discrimination are racism. There's a well-known legal precedent known as positive discrimination. So if you've got a policy that is known to provide particular benefit to a particular group, it can be brought in as what's called a special measure. Now, it's also called affirmative action. You look at how successful affirmative action's been for the Federal Labor Party in terms of the participation of women in Parliament. It's been immensely successful, and that's why we're enjoying a very large number of female politicians federally. So this is an example of affirmative action. We had a policy that enjoyed significant support from Aboriginal leaders and leading Aboriginal organisations. It didn't enjoy the support of all Aboriginal organisations, but legally it's not required to do that. It's required to have significant support, which it did have, and it's also required to be immensely successful and effective, and it was very effective. It prevented domestic violence, it prevented child neglect, it did all the things that you would hope a good policy on alcohol would achieve. And unfortunately, we've seen the precipitous removal of that policy, and I think possibly there was a misunderstanding between the federal government and the territory government. I think there was a thought it was going to be continued under territory law. That's not what happened, and we're in the situation we're in now. But the good thing is that we do know what works. We can address this by bringing back the policy that was in place.
Do you think the call for federal intervention, also via deployment of federal police, might be an assistance in the short term, as we see hundreds of kids, apparently, according to the front page of the Australian, the report today, basically roaming the streets as the end result of the scenario and the neglect that you speak of?
Yeah, well, also in that story today, Matt Patterson, the mayor, he's quite a young mayor. He's in touch with what's going on. He made some really important points as to why those young people are on the streets. He said himself, they're almost certainly safer on the streets, because when you've got so much alcohol consumption happening in homes, there's violence, there's domestic violence. Young people aren't being fed. Homes aren't safe, so they're on the streets. So first things first, we had a policy that worked. It reduced alcohol supply and alcohol consumption. It reduced violence in the home. You know, if that comes back into place, this will have an impact on the young people on the streets, as well as on the violence against women and children, the hospital. And as you said before, the frontline workers in the health system, they're exhausted from COVID. They've got this on top of it. The child protection workers, everyone's frustrated because this is preventable. Everyone is happy to do their job if they know that they're up against the long-term social determinants. And we haven't addressed the long-term social determinants of addiction. That's quite clear. That's why we've still got to have safety nets in place. This was a safety net that's needed until we see the improvement in intergenerational harm to children, and that's not evident yet.
Yeah, indeed. And Marion Scrimgeour, as we touched on earlier, Labor member for Lingiari, she said today on Melbourne Radio 3AW that the voice, these are her words, the voice couldn't be further from people's view up here because people are under siege in their own homes. So a pretty clear message to the federal government from one of their own backbenchers.
Yeah, look, it's like Maslow's hierarchy of needs. If you're living in fear of violence, if you're living hungry and unable to get food, your first priorities always come first. It's normal. You can't think about other important. It's not to say the voice is not a critically important policy reform. It's that if people in a context where they're living in fear of their lives because of violence in their homes, there's not enough food, young people can't get fed, young children are being neglected, those sorts of things take number one priority. But as I said in the introduction, if the voice, Indigenous Voice to Parliament had have existed, it would have enabled Aboriginal leaders to say to the federal government at the time, don't remove this policy until you've got a guarantee that it's going to be continued by the Northern Territory government. Otherwise, it needs to stay in place with Commonwealth legislation. That might have completely prevented what we're seeing now. So they're not unrelated. There are practical potential implications of a structure like the Voice that could have prevented what we're seeing now. But I can understand that people on the ground at the moment have got absolutely pressing priorities in terms of the violence and harm that's in the community, which is preventable. And as I said, we have to go back to the future. We had something that was clearly working as long as we've got the police on all the outlets. Now, the police are just as frustrated as anybody. It's rendered the Pallies ineffective. You can have police on outlets now, but they can no longer stop people buying takeaway alcohol without this legislative framework, which gave them the power in which they could operate. So it's a no-win situation for everyone at the moment, and we have to go back to what works and then look and see where we are.
Dr John Boffa, I know you're on leave. I appreciate you breaking that leave. A GP in Alice Springs, you know this issue better than anyone, and a spokesperson for the People's Alcohol Action Coalition. We hope to stay in touch with you over the next few weeks and hope to see some improvement, some change in policy. Dr Boffa, thanks.
Thank you very much, Karen.